Welcome. My name is Dr. Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process, so when I see you later, we can have a good discussion. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is gallbladder disease? Gallbladder disease is a problem where the gallbladder duct becomes blocked by gallstones. These gallstones occur in the gallbladder for a variety of reasons, but this blockage affects the digestive process of the body and can be chronic or acute. The liver makes bile, which helps digest foods. The gallbladder's function is to get this bile and concentrate it, making the digestion more efficient. If the bile duct becomes blocked, then the plumbing system does not work and the bile does not reach the intestine and disrupts this digestion. This is a description of the anatomy for gallbladder disease. This is the liver, this is the gallbladder, this is the stomach, this is your pancreas, this is your bile ducts. Normally your liver makes bile. Bile helps digest foods, especially fatty, greasy foods. The bile that your liver makes goes down these bile ducts, enters in your small intestine. The food you eat is in your stomach. The stomach then pushes the food down into your intestine and helps digest the foods with the bile present. Your gallbladder's function is to get that bile, concentrate it, and then secrete it into the bile ducts when you eat. That way a more concentrated form of bile comes into the small intestine here. It helps with digestion. It makes it more efficient. In patients who have gallbladder disease, the gallstones cause a blockage in the bile duct of the gallbladder duct. Thus, the bile cannot come out into the main bile duct because of this blockage. Your gallbladder still gets a signal from your stomach to squeeze, and the repeated squeezing causes inflammation of your gallbladder. Symptoms may be constant if there's a blockage that does not remove, or intermittent if the stone falls out every so often. Occasionally a stone can pass from your gallbladder into your cystic duct here, and all the way down your main common bile duct and get lodged in this section here, causing blockage of your pancreas duct and of your common bile duct, causing severe symptoms. Occasionally the stone will fall out or may need to be removed. Sometimes a gallbladder can become sick without gallstones, but this is less common and is treated in the same way. What are the symptoms of gallbladder disease? Symptoms may include intermittent abdominal pain with radiation to the back or shoulder, nausea with or without vomiting, bloating, and diarrhea. These usually occur after eating, especially fatty, greasy foods. These symptoms usually need surgical consultation and typically resolve with surgery. Severe disease may also include jaundice, fever, low blood pressure, vomiting, and may necessitate going to the emergency department for evaluation. Who is prone to gallbladder disease? Gallbladder disease can affect both men and women. It is more common in women and can be characterized by the 5 F's: female, forty, fertile, fat or obese, familial. It is very common in the United States and in New Mexico. It is diagnosed with an abdominal ultrasound or a HIDA scan in correlation with clinical history. How is gallbladder disease treated? The only cure for patients with gallbladder disease is with surgical removal, usually on an elective basis. Some patients try diet modification and avoidance of fatty foods, but the vast majority of people end up needing surgery in the future. Elective surgery is easier and less risky than emergency surgery. How is gallbladder surgery done? Gallbladder surgery, or a cholecystectomy, is done via the Da Vinci robotic system, usually through one small incision that hides inside the belly button and minimizes any scars. Once a patient has gallstones and symptoms of those gallstones, surgery is recommended. The way surgery is done is 2 clips are placed on this duct, called the cystic duct, and the gallbladder is removed. Then the liver will make the bile, as it usually does, just needs to make more of it. The gallbladder is not needed for survival. It's very common to have the gallbladder removed in these instances. Risks of the surgery would include injury to any of these structures in this vicinity. The goal is to put 2 clips on this duct, not here, 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 or down here. The way we do this is with surgical technique and using the robotic system to help identify this duct using the Firefly cholangiogram, which gives me a road map of these bile ducts. At the time of surgery, I inject some dye in through your veins. The dye gets taken up by the liver, secreted with the bile, and the bile ducts then light up with a special laser on the robotic camera. Then I know a road map is present, and I can find which of these ducts I need to clip and remove. Only a select few of surgeons know how to do this method. It is specialized and more complex to complete. Most patients go home the same day and rapidly recover over the next several days. Other ways include laparoscopic surgery, which have 3 or 4 incisions, and traditional open surgery with a large incision on the abdomen. I know how to do all of the techniques for gallbladder removal. I prefer to use a robotic system because in my hands it gives me several options. Number 1, smaller cosmetic incision with rapid healing and improved pain profile. Number 2, superior visualization at the time of surgery with high definition 3-dimensional visualization. And number 3, the ability to get a road map of the bile ducts without making any holes in the bile ducts. This is called a Firefly cholangiogram. And number 4, the robotic system I feel helps me prevent any of these known complications in surgery. Thus, in my hands, it's safer compared to other methods I use. Is robotic surgery safe? Absolutely, it's very safe. And it's the most common surgery that I do. I have done the most robotic gallbladder surgeries in all of New Mexico. It is rapidly growing as the preferred method, especially amongst minimally invasive surgeons, specifically in larger cities in the United States. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include, but not limited to, bleeding, infection, injury to the bile ducts or surrounding structures, bile leakage, hernia formation, or wound complications. These complications are relatively rare and are more common with emergency surgery and with long-standing disease, but can be treated if occur. Minor risks include postoperative diarrhea, which typically resolves quickly, atypical scar formation, and expected pain after surgery.